Hey class, Ms. Casper here. Today I want to show you guys how to come into the clinic and set up your chair when you arrive for pre-clinic. So the first thing that you're going to do is find your assigned chair. The chair numbers are right here on the pole. Then you can stow your personal items like your backpack or your water bottle under here. It's actually best to keep your water bottle in your locker. I just found somebody's right here, so I'll dispose of that. But this is the cabinet where you're going to put your personal items, okay? The next thing that you're going to do is you're going to sanitize your hands. You can do this in one of two ways. You can either use sanitizer and you can get a little pump of it, rub your hands together until they're dry. Or the alternative is you can use soap and water. If you use soap and water to wash your hands, all of these sinks, by the way, have a foot pedal here, then you do want to make sure to lather for 40 to 60 seconds, okay? Our sinks kind of make a little bit of a mess, and also when you take your foot off the foot pedal, it may continue to go, so you may need to also use this knob on the sink as well. You want to dry your hands really well. Please try to keep our clinic nice and clean and also just wipe down the sink real quick. Okay, now the first thing that we want to do is we want to fill up our water bottle. So we're going to make sure that we have two switches in the off position. Our master switch needs to be off. This is on your bracket table, which is what this part is. And the second one is your water switch, which is right over here. So that should be off. This is your water bottle. There's a notch right here. This component stays on the water bottle, so you're just going to turn the water bottle until it slips off and try to avoid touching this straw. Next, we're going to fill up our water bottle. We have to go across the clinic near chairs 1 and 2 because there's a deep sink, and this is a large water bottle. So I find that that's the only sink I can really fit my water bottle in. Okay, so my water's right about here, so that's good. Okay, and now that we have our water bottle filled up with water, now we need to put our maintenance tabs in the water. So all the cabinets above the sinks should have a box that looks like this, that says blue tab. These are our waterline maintenance tablets. It keeps our waterline clean and free of biofilm. And for this size bottle, you want to use 2 tablets. So they're pretty easy to open. You just want to tear it off. I try to avoid touching the tablet, and I just drop it in there. The other thing that's really important is to try to gently mix up the water to encourage the tablets to dissolve. If you put the tablets in your water right away and then you connect your water and you begin to use something like an ultrasonic scaler, if those tablets haven't fully dissolved, it could clog the line. So I usually swirl my water bottle a little bit like this, and then I attach it. When you attach the water bottle, again, you want to try to avoid touching the straw and then line it up and turn it to secure it in place. Now we can turn on our water switch and we can turn on our master switch. And make sure this water switch is on as well. Since I've touched my water bottle, I've touched the cabinet, I've touched the sink handle, I like to take an extra measure and do some sanitizing once more. Now it's time for me to get my chair barriers set up. I'm going to move my bracket table, get my light in position. This is a foot pedal or rheostat. It's the proper name. This is for our hand pieces, like if you were to do coronal polishing, and this is for the ultrasonic scaler. In your cabinet, at each operatory, there should be barriers. We have these, they're actually garbage bags, trash bags, but they work really, really well as chair covers. So you're gonna need one of those to put over the back of the chair. When you come into clinic, everything should have been disinfected from the student before, so you shouldn't need to come in and disinfect everything again. You can set up your chair with clean hands. Okay, so bag over the back of the chair. Then we're going to get our air water syringe barrier sleeves. You'll need one for your saliva ejector and one for your air water syringe. We have 2 air water syringe options. You can choose which one that you'd like to use. There's one on this extension arm. The other is right here on the bracket table. So whichever one you decide that you're going to use, that's of course the one that you're going to put the barrier on. If you're doing a procedure such as periodontal charting and you're going to need your keyboard, then I would also suggest grabbing a keyboard cover, which is this long kind of rectangular shaped barrier. In the upper cabinet, then you should be able to find a saliva ejector and an air water syringe tip. Again, as long as your hands are clean, you're able to open up these cabinets and grab whatever supplies you need as long as you have clean hands. So when you attach your saliva ejector, you're just going to use some moderate pressure to insert your saliva ejector. Place the barrier over the saliva ejector. Before you have your patient come in your chair, it's nice if you leave the saliva ejector completely covered, just like that, and put it back onto the arm. Then for your air water syringe, you depress this outer ring with your finger. I like to use my thumb, and then insert the air water syringe tip. Let go of the outer ring and then just test it, make sure it's secure. And then you want to put your barrier over. Now we're going to place a barrier over our tray, and if you look at your barrier, there's a little end that has excess material that's folded. That should go on the top of the tray, and you'll see why in just a moment. This is found in the cabinet where the other barriers are kept. And now you're going to take that excess and fold it over. So now it's on the bottom of the tray. And then go ahead and place your tray back on your bracket table. So we should have some blue tape. If you can't find it at yours, go to the next chair and see if you can find it. Here we go. So I'm going to borrow my neighbor's. So we want to place this barrier tape over anything that we're going to be touching with contaminated hand that we can't properly disinfect. This is the control panel on the chair. The more this gets wiped down, the ink that's covering the panels starts to wear away. So we do want to put a barrier over that. Okay, so we'll put barrier tape over there and then fold it under. We don't need it on this handle because this handle is nice and smooth and we can easily disinfect it. We do, however, want to put it on this switch because there's some very small nooks and crannies where bacteria could potentially hide and we can't properly disinfect. The other places where you're going to want barrier tape. When you are treating your patient and you're doing documentation of your assessment findings, you're going to need a cart. We like to try to keep this cart clean and free of cross-contamination, so we want you to put barrier tape only in the sections that you plan to grab with your contaminated hands. Just on the sides. That way your paperwork, which cannot be disinfected, can lie right in the middle. So you can move your cart like this with your contaminated gloves. Most of these carts have a laminated barrier in the top drawer. This is the barrier that you'll use to cover your paperwork, and you'll need to grab one more piece of blue tape to wrap a pen with. We like to use a combination of red and blue pens when we have you document some of your assessment findings, so I would wrap up a red and blue pen. It's a little easier to get the barrier tape off your pen if you fold the ends before you wrap it. Just like that. So that way when you are documenting, of course you would have your full PPE on. If you had a glove that was contaminated, you could rest your hand on the barrier, extend your pen out to write on your paperwork so you're not contaminating your paperwork. Your wrapped pen always needs to stay on your barrier. Last thing that we want to put barrier tape on is the chair that you're going to be sitting in, because you may have to make some adjustments and you may have to touch the handle on your chair. I see one thing that should not be there. I walked into the clinic and the person that broke down this chair before left tape on there. So I cannot assume that that is clean. So I will need to clean that. That's a big no-no. I will show you how to break down a chair. But for now, we are going to use this chair, and I will put a piece of barrier tape on the handle. So that way, if I use it, I'm not contaminating this handle or all of the extension arms. And that's how you set up your chair.